priority, caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky. Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
If you or your loved one is facing cancer, only Sylvester will stand firmly by your side at every step, from diagnosis through survivorship, providing you and your family peace of mind and assisting with everything you need before, during, and after your stay with us. Sylvester Comprehensive Cancer Center is South Florida's only NCI-designated cancer center and specializes in treating the most complex cancer cases. Your first-class cancer care is just a flight away. Learn more at sylvester.org.
Hello, good people. This is Uncle Selvin. Long time you not hear from me. When I was growing up around here, if you was not feeling too good, there's nothing in a dip in the sea couldn't clear up. Or better yet, your mama would fix you some good bush tea. Mind you, they still works. But the truth be told, those were simpler times when advice about your health and wellness was pretty straightforward. And you trusted it. Today, around here for trusted advice, the folks at Healthcare Pharmacy is the ones I trust. Their team of healthcare professionals and pharmacists have been serving this community now for over 30 years. Healthcare Pharmacy with 2 locations, Grand Harbor and Governor Square. You can reach them wherever you is.
Hello and welcome to For the Health of It. I'll be interviewing Dr. David Quinter from Cayman Medical Center, and we'll be talking about the services of that establishment. Hello and welcome to For the Health of It.
Oh, thank you, Tara. It's nice to be here.
Yes, it is indeed. You're new to the show, so that I love having new guests. Explain to our audience the services that Cayman Medical Center has.
Definitely. The Cayman Medical Center is a institution on Eastern Avenue. We have a full service of pain management specialists, if you wanted to kind of characterize it in a certain way. So myself, I'm the family doctor, so I'm often the first point of contact for someone who has maybe a joint problem or a muscle problem or some sort of pain syndrome or just an undifferentiated issue. And that's really the place that I kind of specialize, is trying to sort out what the nature of the problem is and take it from there. We have some very complementary services in the facility. So there's a couple physiotherapists, the orthopedic surgeons from Island Orthopedics. We have a pain management specialist, a chiropractor. There's an open MRI in-house, so that's a very useful diagnostic tool. And we have a mental health counselor as well.
So you have like a full scope of services.
It's nice. There's a team, and often, that's exactly what a patient needs when we identify, for instance, if I identify a patient with a problem that needs imaging, we can set them up, show them the machine, and let them know kind of what to expect. Or if they need to see an orthopedic surgeon, sometimes we can introduce them when they're actually in office at that first visit, or similar with a physiotherapist. So it's a very good experience for the patient, and it's nice for me as a practitioner, because then I know that handover is clean and nothing is getting lost to follow up, and the timeliness for the patient is very good, and it's convenient for them because they keep coming to the same place.
Yeah, that sounds really good. Now, what's the difference between, say, HSA and Health City than Cayman Medical? Doctor's Hospital.
Yeah. So, I'm relatively new to Cayman, so I'm sure you and your listeners know, as much or more than I do. But just in general, it's my understanding that HSA is, your major public health care facility. So, they have the largest inpatient capacity, the ICU facilities, So for people with, very complex needs or, needing certain emergent care, that would be the place to go. For Health City, it's my understanding that it was actually born of a public-private partnership, and it has some sort of special legal status originally for medical tourism, and there's some sort of different process for physician licensing than the other facilities. But they do have some specialist services that aren't found elsewhere on the island, some cardiologists that specifically that offer extremely specialized care. And there's other facilities as well that have kind of different combinations of services.
But you guys have urgent care too. Why would I come there instead of going to HSA or?
Well, you certainly can. It depends on convenience, familiarity, insurance status, and there are definitely a few options. So for myself, I would point out the fact that I've got quite a wealth of experience from where I was working before coming to Cayman. So I was the physician responsible for an emergency department where I was basically the only one in the building, the only physician in the building for a service area of about 20,000 people, and we were about 200 miles from St. John's, which is our tertiary care center. So there were occasions where I got in the medevac helicopter to take the patient to St. John's when they were quite unwell with the respiratory therapist and nurse. So being that kind of sole person responsible for the 20,000 souls, as it were, on the peninsula, you see a wide range of things and get a lot more experience than if you're somewhere where immediately a specialist jumps in. So that gave me experience from the whole spectrum of dealing with prenatal care to newborn care, care of children, care of the elderly, preventative medicine, chronic disease management. Just a really good, breadth of experience, as you might kind of think of as a traditional kind of country doctor sort of role. So special procedures as well. I mean, I can go on. It's just, it's really nice. It's why I went into, this field and family medicine, specifically in rural family medicine, even more particularly. So if somebody wants to see someone who, is really good at those undifferentiated conditions and has a lot of experience, and I would suggest that they, consider coming to Cayman Medical to kind of get their workup done and see what the next steps would be for them. Hopefully we can help them.
Your bio said that you had over 8 years experience, so that probably makes you, and working in pressure cooker conditions, probably makes you a pretty good dietitian. Is that how you say that?
Diagnostician?
Yes.
Yes. Yes, for sure. Now, I mean, thankfully, when it comes down to it, if you're dealing with a real, true emergency, you've got your ABCs, and I've done this ATLS course, 4 or 5 times, and, we know how to deal with unstable patients and people with arrhythmias and that sort of thing. And so, yeah, stabilizing a patient to the point of evacuation, if it's quite a serious matter, is relatively straightforward. Actually, the hardest cases are the ones where someone might have seen several people already and haven't really arrived at a diagnosis or tried some things and had partial improvement. And actually, you see that quite a lot in emergency departments. So, yeah, that's where the real diagnostician hat comes in. And yeah, I've seen my fair share of those challenging cases. And, yeah, they're quite fun.
Okay, so part of what I'm understanding is Cayman Medical Center offers medical marijuana scripts, right?
People have picked up on that pretty quickly. It's interesting. There's quite an energy there, and people are keen to pick that out of my bio. So I trained in Canada, where medical cannabis has been legal since 2001. And it's actually been recreationally legal since, I think it was 2018. So my whole training has been in an environment where it was legal. So it has kind of been normalized for me to some degree. And I can see how, there's interest in that, where I think it was only made legal here in 2017. So, yeah, we can certainly talk about it. It is quite helpful for certain conditions, but there are caveats. Like other pharmaceuticals that can have psychoactive effects, they are prone to abuse. And the important concept is to think about it like any other drug, any other drug like that, and realize that there's what we call a therapeutic window. So that's a dose at which you get the benefits of the medication, and for cannabis there are many evidence-based benefits. So a dose where you get the benefits, but that's below the top end of that window, above which you'd get some adverse effects. So when you're in that window, there's a lot of positive effects you can have for people and relief from symptoms, and you can really help people, which is the whole point. You run into problems when people take it and continue to take it when they've gone beyond that window. When they're having adverse effects and continuing to take it. And we call that drug abuse, and that happens with other drugs too. That happens with alcohol.
Yeah.
That happens with the opiates. That happens with benzodiazepines.
What are the conditions that it's good for?
So there's a lot, and actually the evidence is kind of mounting for a lot of things. So from very specific diseases, neurological conditions, so the muscle spasticity associated with multiple sclerosis, the multiple symptoms of Parkinson's disease, so tremor, dyskinesia, which is abnormal movement, anxiety of Parkinson's. Those have all been shown in really good studies to benefit, but people also use it for common conditions, which there's evidence for as well. Insomnia, which at low doses can decrease the onset of sleep, so the time it takes to fall asleep, and it can increase your total sleep time. For various forms of pain or pain syndromes, from osteoarthritis to rheumatoid arthritis, cancer pain, migraines, some gynecologic pain conditions, including endometriosis and interstitial cystitis. And more generally, people do use it for anxiety, and you have to be careful. There's a lot of literature that shows that proper low doses, it can relieve anxiety and elevate mood, but at high doses, when you're going above that therapeutic window, you can actually worsen anxiety and depress mood. So that's where medical cannabis, really, you get that capital M in front of the cannabis, and you need to have prescribed doses and careful formulations and a start low and go slow approach to prescribing, and you need that that relationship with a physician who's monitoring it, and make sure that you're getting benefit without side effects. And selecting your patients is also very important. This isn't just for anyone who says that they have a certain symptom. There are definitely some contraindications. So if a common situation is somebody will kind of sheepishly say that they've used it, and they got it from the illicit market, and they find that it really helps them, but they don't want to be smoking it. Mm-hmm. And that's a very real concern, because anyone with a lung disease, so asthma or COPD or emphysema, they should not be smoking anything. They probably shouldn't be vaporizing anything. Mm-hmm. And there's unpredictability in the supply of the cannabis that they have. And if you can tell at that point, they've already kind of selected for using it, because if they're coming to you and they're not running into problems, it's not what we call a dysfunction, so it's not interfering with their work or family life, or they're not having legal problems, they're otherwise functional, then it's much easier to support that, and you're probably doing a net benefit to them in writing a medical cannabis prescription. If somebody comes to you and they have a condition, and the idea of medical cannabis hasn't even come to mind, it's a lot harder for me to be the one to suggest it, because then you're introducing some small probability that they might be tempted to abuse it. Mm-hmm. So that's pretty rare circumstances where that would ever come up. And then the other important consideration is if someone has a significant mental health history, so a history of schizophrenia or bipolar disorder, that's a major red flag, because they might be more likely to use high doses or have adverse effects. And similarly, there is some evidence of harm in young patients. So that's pretty much an absolute contraindication. If you're under 25 is usually the cutoff, because we know that the brain is still developing until about age 25. And there have been some longitudinal studies that have shown harm. If somebody starts using cannabis and they use a lot at a young age, it will, on average, there was a really good study out of New Zealand that followed people for 27 years that showed that they would have some long-term negative cognitive effects. So,
is that even with taking pill or oil form, or is that just smoking? Vaping?
That was just smoking, because that study was, it took 27 years, so I don't think there were these kind of medical formulations that we have now, these extracts that are, purified and standardized.
So in Cayman, I can walk down to the dispensary and whip out my vape pen and say, fill it up?
Not quite. So actually, not all the pharmacies carry any cannabis products. So you have to do a little bit of research, and you should work with a physician who's experienced with this. But there are some that carry, so the forms that are legal here are the oral ingestible capsules. So picture, like a vitamin D capsule, it's just like that. And there's oral ingestible drops, so it comes with in a bottle with a little dropper. Mm-hmm. And there's an oral vaporizer, a vaporizer pen in which it's inhaled. So you need a prescription to pick up any of those, so it has to be a physician licensed in Cayman. And while we're on the topic, the indication that you're taking it for really should influence which form you take. So a chronic condition like pain, let's say osteoarthritis, and it stops you from getting your exercise. Something that's longer duration like that benefits better from a capsule or the drop that you swallow, because the time profile would be a little bit slower onset, longer lasting, and so it won't just kind of wear off midday. Whereas if you're taking it for pain, let's say you have muscle spasticity or a migraine or endometriosis kind of pain, and it comes on suddenly, then you do want that quick onset, and that's where an inhaled vaporizer would be the suggested route for that.
When do you do the drops?
Well, it depends what you're taking it for. If it's for sleep, that would probably be one that's actually better with the vaporizer, but you can time these things. So, and for sleep, we're talking about, this is probably like a second line or third line, kind of fourth line treatment. But often, with melatonin, you'll take it, half an hour before you're going to go to bed. Same idea for an oral ingestible. Those can take a couple hours to kick in. So you might have it after supper if you know for sure you're not going to be, driving or doing anything else.
You mentioned earlier, like, you could use it for Parkinson. Does this help with the tremors?
Yeah, so there's actually a really interesting study that looked at a large group of patients with Parkinson's, and it wasn't a uniform response in everyone, but altogether there was significant improvement with the tremor, their dyskinesia, so involuntary, large movements rather than just the fine tremor, and also anxiety and well-being. So these patients felt like their quality of life improved. Now it wouldn't be, you don't get the exact same improvement in every single patient. Like these are, means, and so averages with, a certain amount of variability between the individual patients, but altogether there was a significant effect, and it's very much individualized. So long as the patient is willing to, work with you and, go on this a therapeutic trial and have reassessment, I mean, you can find non-responders and move on and try different things. So that's where that relationship really comes in. It's not like you're treating, if somebody has an ear infection and you give them an antibiotic, you're 99% sure it's going to get better. Or a urinary tract infection, those are very straightforward, and you can kind of write the prescription and, say come back if it doesn't get better, and you're quite confident it'll resolve. This is, these are conditions where, there needs to be some monitoring, and it's a medication that, you're unlikely to find the perfect dose and frequency and route of administration with your first try. So, okay. But there's enough people that are finding benefit that, people with any unresolved symptoms that have tried other medications, they really do, deserve a trial of medical cannabis if it might be appropriate for them. If I could add one other thing, sure. What's really interesting is when you look at the United States, so more than half now have medical cannabis is legal, and some of them it's recreationally legal. There was some observational data where they looked at all those states, and they actually found that the states where it's legal medically or recreationally, they actually have lower rates of prescribed opioids and reduced opioid-associated mortality. So, anytime we can reduce the use of these, traditional quote-unquote painkillers, we should. From my time working in the ER, I can't remember how many times I saw opioid overdoses and how, serious and life-threatening those were. These patients many times would have died if it wasn't for naloxone and the intensive observation, and often we'd have to put them on these infusions of this drug. So anytime we can decrease the amount of that's being prescribed or that's out in the community, that's definitely a chance to do some additional good.
Is this good for treating, say, people with neurological, not just neurological pain, but for those who have like epileptic fit?
Yeah, that's actually a really interesting area, and there are some studies in pediatric patients who have severe forms of epilepsy, some genetic versions that present at a young age, and these are patients that could be having dozens of seizures a day or more that are uncontrolled with traditional medications. Some of them have just night and day responses to medical cannabis. For me, it's probably not an indication that I would end up being in the position to start a prescription for it, because these patients would most likely be under the care of a neurologist or pediatric neurologist. Mm-hmm. But certainly the literature is quite interesting. And it's just interesting also to think about things like migraines and seizures. They're usually triggered by stressors, and usually they're additive. So it could be if someone's a little bit sleep deprived, and maybe they skipped a meal, and maybe they've got a cold, that only when those kind of stars align, so to speak, would it trigger a migraine or a seizure for them. And in some of the patients, anecdotally, they'll say that when they have that medical cannabis, it does reduce just the cognitive stress, and maybe that is frequently one of the triggers that's putting them into a migraine or a seizure. So there's much more that we don't know than we do. We haven't even touched on the cannabinoid receptors that are these things that are in our physiology, because we do kind of naturally make these compounds that bind to these receptors. And it's still early days in understanding it, but the safety is pretty well established, so long as we're not introducing any source of substance misuse or abuse.
So what I've noticed in today's world, there's a lot of young adults with severe anxiety. Mm-hmm. So they're between 18 and 20. They come to you and say, "Hey, doc."
Yeah, it's not for them.
Okay.
That's a natural part of growing up to some degree. Absolutely, some have organic mental health problems. Some will have some underlying metabolic problems. One of the most common reasons or ways that like an iron deficiency anemia or a hypothyroidism or a vitamin B12 deficiency will present is as anxiety. And sometimes it's not even as anxiety, it'll be as insomnia. And then you ask the right questions and go through the history, and then you find out that this person's actually anxious and they're having panic attacks for the first time, and then figure out what are these stressors, and are these stressors things they would have coped with before or not. And so there's a stepwise approach to working these things up. But even in the case of, let's say, an 18 or 22-year-old with some uncontrolled anxiety, you have ruled out, we'll call them organic causes, there's still other options that need to be pursued until that person is, an older adult, where that kind of window of brain development has closed and they've reached, their life trajectory, so it hasn't interfered with their education or professional development. It would definitely be, I think, a big mistake to start someone like that on medication that could be abused if they weren't careful.
Who are your clientele?
So I've had a mix of patients. There've been a fair number of foreign workers, people, some Caymanians, some expats. It's quite a mix. I mean, where we are is a pretty central location, and it's a busy street. So I've only been here just a couple months, and so sort of taking all comers, and I think that's probably representative of Cayman. There's there's people from around the world and locals, so it's really been fun.
Okay. Is there anything you'd like to add that I haven't asked you?
Yeah, I would just invite anyone with questions about this or anything else to come and see me. Another area of interest that we didn't touch on is regarding early medical screening and healthy longevity. The patient population I cared for in Canada was much older, so I did a little audit, and my average patient was 65, and that was the average. I think the median would have been way more because I did have some kids and newborns. Here, it's much younger. If you look at a population pyramid of Cayman, there's like a bulge between 50 and 60, whereas in Canada, it's decades older. So there's a real important opportunity to get this screening done to pick up cases of diabetes and chronic kidney disease and hypertension. Because if you detect that stuff early, you can reverse it and avoid very serious problems, heart attacks and strokes and peripheral neuropathy. And I've had cases of pain coming to our pain center that it turns out this person's a diabetic and they just hadn't had it picked up yet. So I would encourage everyone to get your screening done, and the guidelines are being revised earlier and earlier. So where we used to start screening for some things at 50, now it's 40, and in some cases 35, and actually depending on your genetic makeup, even as early as 25. So even if you had this stuff done once years before, a lot of this needs to be every 1, 2, or 3 years. So just follow up with your family doctor and make sure they're on the ball, and the prevention is critical.
Yeah, we don't want to get too much into curative, but if we can get to the prevention, I mean, what I'd like to see more of is the A1C, doctors looking at that 5.7 and looking at their patients in the eyes and saying, you're on the borderline of being pre-diabetic, or you're pre-diabetic, because that's what the indications are. But I think we wait a long time until they're sixes.
Yeah, the problem is these things don't have symptoms, and people wait for symptoms. But once, if you're diagnosing something, in the emergency department, or when someone's symptomatic, you're on your back foot, and you've really lost some opportunity to kind of change the course early. Obviously, you tackle whichever problem's in front of you, but it's the early screening is critical. It's not a challenging thing. It's not a painful thing. Just make an appointment to see your family doctor and make sure that they're on the ball and you get the follow-up so that everything stays up to date.
How can people reach you?
Well, they can call my clinic at 623-1000 and ask for Dr. Quinter. And we've got a WhatsApp business account where you can text or WhatsApp or call, and that's 324-2424. And that's Dr. Quinter at the Cayman Medical Center.
All right. Thank you so much. You've been listening to me interview Dr. Quinter, and you've been listening to For the Health of It. We are moving you to the life you want.
There's nothing more important than your health, and seeking expert healthcare with physicians you can trust is what you deserve. UHealth, the University of Miami Health System, offers peace of mind to you and your family with a first-class experience. Our patient coordinators assist with everything you need before, during, and after your stay with us. As South Florida's only academic-based health system, UHealth offers cutting-edge treatment, compassionate care, and life-changing results just a flight away. Learn more at umiamihealth.org/international.
When I first started going to Healthcare Pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy, with 2 locations, Grand Harbor and Governor Square, where they care about my health.
This is For the Health of It with Tara Bush. Brought to you by the Health Services Authority. Caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky. Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadena Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the health of it with Tara Bush.
Yesterday,
Today,
always and forever.
Radio Cayman in the Cayman Islands.